Hello, everybody, and welcome once again to Functional Medicine with me, Dr. Howard Robbins. Uh, our show is dedicated to safe and natural and effective ways of treating diseases and conditions that nobody seems to have anything other than remedial ways of helping the symptoms of. And we're here about not just improving them, but getting rid of them if possible, permanently, completely, once and for all. We'll be talking about myasthenia gravis today. MG is its initials. And if you have it, boy, you know what it's all about. I first want to thank my two sponsors, Doctors Biome, doctorsbiome.com, very important um, probiotic product. There is nothing like it on the market. It's 15 patented strains of probiotics that are living in a 100% delicious organic juice. And so living is the key because they don't have to come out of suspended animation like capsule powder and tablet probiotics do, which basically don't. The freeze drying process, unfortunately, destroys most, if not all of them. And then once they do come back to life, if they do, they have to grow into healthy adults. Well, in Doctor's Biome, they're already healthy adults creating new baby probiotics every single day. So you're getting tens and tens and tens of billions, if not hundreds of billions, from the time it's manufactured. And as I said before, it's delicious. It's in a 100% organic mint, kale, lettuce, celery, cucumber, apple juice. You got to order it online. It's the only way to get it, other than many doctors sell it in their office. Sold all over the world. Sold in the EU. It's sold in the UK. It's sold in Southeast Asia. So it's pretty much sold all over the world. And of course, it's free shipping from the company with 100% money back guarantee. So you got to like it or else you get your money back. Um, um, Go online to Doctor's Biome. It's all spelled out, DOCTORS, Doctors, BIOME.com. Yeah, BIOME, Doctor's Biome, sounds like biome.com. And when you get there, you'll learn all about it. And when you buy it, I'll get you a 10% discount if you use my patient coupon code, Howard35. That's all. And give it out to whoever you like. Okay. And you get actually another 10% off if you go on auto ship, which is a smart move because they make it in small batches and they run out of it all the time. It's frequently on back order. So as soon as the lab frees the next batch after safety testing, which is, mandated and done consistently all the time, auto ships get first shipment. So not only do you save an extra 10%, you get 20 total percent off with the coupon code and with auto ship, but you get priority shipping along with the free shipping. So hopefully you'll never run out of it. And once you start using it, you won't be sorry. If you listen to some of my podcasts on digestive diseases and on probiotics, you'll understand a lot more about it. Next, I have to thank, and it's going to be very important to you as part of the way to treat MG, is to go to promolife.com, PROMOLIFE.com. Actually, it's best if you call them. And you want to write this down. You call them at 888-742-3404. That's 888-742-3404. Tell them you heard about it on my show. They'll give you something off and or something thrown in special, and you want to get set up for home care. Why? What? That's what we'll be talking about in the show. You'll be doing home care ozone therapy, not intravenous. We'll talk about that, but home care ozone therapy. And this is how you'll get set up for it. They're one of the best companies in the world to get products and affordable as well. So when you listen to the show, you'll understand why ozone is very important in the treatment of this. Okay, so in fact, let's get to the show. So myasthenia gravis is basically a chronic autoimmune disease. It can get various degrees of weakness in all your voluntary muscles. So commonly you'll see drooping eyelids and difficulty speaking and walking, swallowing, shortness of breath. Um, Basically, it's a pretty serious thing because it can affect, um, gives you, well, like when you're walking, you get your feet can go numb. They feel like they're getting heavy. You feel unstable. You can fall down, hit your head, and die. I mean, this is not a small thing. It often can cause foot drop, a shuffling, tripping kind of walk, as well. Balancing issues, cramps in your legs and feet. So it's a pretty serious thing. Facial weakness. You may not be able to smile and use your face. Um, Swallowing problems. Some people have very serious swallowing problems, so they can't easily swallow and they can choke on their saliva. Neck weakness, arm weakness, breathing. A lot of serious things caused. They don't really know what causes it. They do believe that there might be a genetic issue to it. I don't believe so, and I'll explain why. Mostly, women under 40 and men over 60 are most commonly affected by it. Um, if there's a tumor on your thymus gland, they know that seems to be related to it. Um, and it explains a little bit about why intravenous ozone therapy could work in helping this. Let's talk about how to deal with it. And that's why I do these shorter shows, not going into all the depth of the disease, because if you have it, you certainly know about it. You don't have to have all the symptoms that I described to have it, obviously, but there are things that can be done to help it. The number one thing is direct intravenous ozone therapy. Direct intravenous ozone therapy, DIV as it's called, in my version of it, RMDIV. You can hear more of the details about it if you go to my podcast called Intravenous Ozone Therapy, Everything You Need to Know. But basically, we help with all autoimmune diseases, and particularly diseases and conditions when they don't know exactly what the cause is. Ozone also in the direct IV method helps shrink tumors around the body. So if you happen to have a thymoma, I think it's called thymoma, sounds weird, sounds like you're lisping. If you happen to have a tumor on your thymus gland, it hopefully will shrink and eliminate it without having to do radiation or chemotherapy or anything horrible like that. We want to try to stay safe and natural with it. And that's what one of the benefits of ozone is. You need to do at least 3 or 4 treatments a week. More is better. And we've seen some amazing results from intravenous ozone therapy in the treatment of MG over the years. Some well-known people that we've seen have had amazing, amazing results. Their eyelids don't droop. They're not wiped out. All the symptoms that I mentioned earlier, not just improve, but can be eliminated completely, permanently, once and for all. The problem is we don't know what we fixed. We know we fixed it. Apparently we did, but we can't say it's cured unless there's a test that proves that it's really gone. And it's basically diagnosed by the symptoms of it. So the way I put it is patients stay a patient and they come in after their symptoms are completely gone for an entire month. They come in once a month. They're always a patient. And this way, you don't have to, be going back and doing consults again and everything. And if they notice any of their symptoms returning, we can always go to full blast ozone again. There are things that you can do. You can adjust your eating habits, so that if you have difficulty chewing or swallowing, you can eat smaller pieces, turn a lot of your fluids into juices. You can be juicing more, and that helps make an ease in swallowing. You want to eat foods that are rich in vitamin A, vitamin D, vitamin E, which are supplements that you can take, omega-3 fatty acids. So, wild caught fish are very good for that. You want to be taking magnesium and potassium and calcium along with vitamin D2 and of course if you're taking vitamin D2 and 3 and you need to take vitamin K supplements with it. Everybody needs vitamin C, 5 or 6 doses a day. You can take that to your stomach's tolerance. It's more important how often than how much, because remember, if you're taking good quality, it'll get absorbed and used by your cells. But whatever you don't use after 2 hours, you're going to get rid of. Body just urinates it away. Creatinine um, may be helpful, but you don't want to do high doses of it. So you keep it to moderate to low doses of creatinine. There's curcumin. Oh, let's see, curcumin. Any supplement that's been shown, any herbal supplement that's been shown to reduce inflammation, okay, that helps in autoimmune, you might find helpful in this. It's certainly worth trying. I always recommend chiropractic and acupuncture for these things as well. Simple, easy, gentle exercise is also valuable. Sleep is important, but I don't want you to be sleeping excessively, and that's why the ozone therapy helps you manage fatigue. You don't want to smoke, you don't want to do any alcohol or any other drugs, that's for sure. You want to stay away from all that. Now, home care ozone therapy for this problem is basically rectal insufflation, which is an ozone enema. It's done very safely, very easy. Promolife can set you up for it. So it's something that you might want to consider buying a home care system and setting yourself up. And you can do it twice a day, morning and evening. They'll sell you the machine. You got to get medical grade oxygen. That can be more of an issue than anything else, believe it or not. And then they sell you these bags with little tube-like things. They call them catheters, something like a thermometer, but soft plastic with little holes in the end. And you would fill up the bag, put the catheter in, get on your back. You always do a fleet enema or a bulb syringe with purified water or distilled water or RO water, and you clean your colon out a little bit first. You want a wet colon. Then you would stick the catheter in, squeeze some gas from the bag, tighten up your buttocks, hold it for a few seconds, relax, then squeeze more from the bag until eventually you have the whole bag, 500, 750, even to as much as 1,000 ml, cc's, mLs of the oxygen and ozone gas at about a 20 to 40 concentration. Start low, no adverse effects. Build up each time you do it. Go as much as a 40 microgram concentration. And it teaches you on these machines how to set it up and do that. Now, if you're doing rectal insufflation only, you need to do it twice a day, 7 days a week. Ideally, you're going to find a way to get to me or somebody that I've trained that does direct intravenous ozone therapy. I am not a big fan of the blood methods of ozone for this particular problem because you need big veins. 6 to 7 out of 10 patients don't have the veins that allow you to take blood out ozonated and put it back in. Certainly the MAH method is a waste. You want, if you're going to do a blood method at all, the 10-pass method would be the way to go because at least you're getting some ozone in the body. The EBU method, I'm not a fan of. Ultraviolet blood irradiation for this, no, although you can add it on to 10-pass and then it makes it beneficial. If you listen to my show called Intravenous Ozone, Everything You Need to Know, it goes over why I use the 3 most powerful ones and the way we use them, what it looks like. But it's the DIV that's fast, easy, less costly, that seems to be the best way to go. Okay, if you have any questions about myasthenia gravis and how to treat it, you can email me at Ozone Doctor, OZONEDOCTOR, all spelled out, Ozone Doctor, at yahoo.com, YAHOO. And uh, or call my office in Manhattan at 212-581-0101. That's 212-581-0101. Now, this is important. The gut connects to every organ and every tissue in your body, every system in your body. You have to replenish the gut. So go to doctorsbiome.com and order Doctor's Biome and start taking it. That alone may make a big difference in your myasthenia gravis. And you can't absorb any nutrients if you don't have a healthy gut. In addition, remember to call 888-742-3404 and go to Promolife. Tell them I sent you and see what it's going to cost you and everything if you can afford it, and get set up for Ozone home care. Everybody subscribe to my channel. We are building up subscribers now. Subscribe to my channel and tell your friends it's free. You may not have a problem today that we're talking about, but you may have a problem in the future, and hopefully we'll have already addressed it. Everybody stay safe, stay healthy, stay well. Tell your friends to look into our show. Appreciate it. Bye-bye now.